What's up, good people? Today I'm going to talk about a very important subject which is called hypertension. And in this regard, I am basically touching base on the high blood pressure. That's an emergency high blood pressure. And there's a term for that. It's called malignant hypertension. It's called malignant hypertension, or sometimes you might have heard your doctor talking about something called hypertensive crisis. They mean the same, but the problem is huge, and that's why I want to address it here so that you don't end up into the trap. Why am I addressing it here? It's because of this huge thing. The research and all those studies that are done on the people who get this high blood pressure, which is high blood pressure of systolic of 180 and above, and diastolic blood pressure of 120 or above, that can lead to a big problem, which is called death. And that's what I'm addressing it here because it's very, very critical. It is a critical care medicine subject. And I want to address it so that you don't end up into it. And because the life expectancy for someone who gets into it could be less than 24 months. So if you got an attack of hypertensive crisis and you don't get yourself treated, you might end up into having somebody with a life expectancy of less than 24 months. And look at the date of this publication, October 12th, on NIH. It's a huge department. It's a government based department. It's not something small, it's not tiny. It's a huge thing here in medical field. So it's a recent subject, it's a recent study, it's a recent research. That's why I want you guys to know about it, that if you are someone who is not controlling his blood pressure despite of having this high blood pressure kind of crisis situation, then you don't have too long to live, brother or sister. Please don't end up into that because life is precious, life is expensive, and you only get it once. Trust me. And even on this place on Wiki, it says that it is estimated that people who do not receive appropriate treatment only live an average of about 3 years. This is an older database thing. Now they have found out that it could be way lesser than that, which is like 24 months or 2 years. So please don't fall into that trap. Make sure your blood pressure is under control. Make sure you have a very good primary care doctor and a cardio doctor who takes care of your medication so that you don't end up into this kind of crisis, because it's going to reduce your life expectancy. Because once you get that, we need your ECG, we need your chest x-ray, we need to test your urinalysis, which is we want to make sure your kidneys are not compromised. We need to check your electrolytes like sodium, potassium, creatinine, cardiac biomarkers, toxic screen, CTMI of the brain. A lot of things need to be done there. We need to do a thorough evaluation. And for more questions on this, please ask me in the comment section. It's a huge publication. It's a very important publication. And it even talks about the treatment that they're going to give you in the ER, as well as at the times when you're not in the ER, but you need to take a regular medication, because you don't want to have a crippled or paralyzed life after this kind of high blood pressure, because you can have something called CVA, which is cerebrovascular accident. In other words, it's called a stroke. So please be careful. Do not end up into that, because you can have a bleed inside your brain with that high blood pressure, because arteries and the veins, they are fragile, they can ooze, and that's what we call hemorrhage. Brain hemorrhage is a huge thing. Or you can have a burst of the biggest artery of your body, which is called aorta, and that we call as aortic dissection. We do not want that, because you are having such a high blood pressure, and this burst can happen within 20 minutes. Please be very, very vigilant. Don't let yourself into this kind of situation, because you can have a cardiac arrest, which is called acute myocardial ischemia, and then the death, which is very, very bad thing, and we don't want that, and that's the purpose of my video, and that's the purpose of my channel, to give you a control over your own health. So please be careful, because if you don't do it, your 5-year survival is like 75%. If you're not controlling your blood pressure after this kind of hypertensive crisis, your 5% survival is like 75 to 84%, according to this publication. And we don't want that low kind of life expectancy. And without treatment, the life expectancy is less than 24 months. So the prognosis of the patient with this kind of hypertensive crisis is very guarded, and 5-year survival is 75 to 84% with the treatment. So even if it's with the treatment, you have to be extremely vigilant, because you want to raise this percentage. You don't want to die within 5 years despite of the treatment. So the goal is to get your blood pressure controlled, so that you never end up into a malignant hypertension or hypertensive crisis, and therefore you don't end up into this category that, yeah, I am getting treated, but I got 1 episode or 3 episodes or so many episodes of malignant hypertension, and now I am into this trap of 5-year survival of 75 to 84% despite that treatment. You don't want that. What you want is you have a regular treatment plan for your high blood pressure, so that you don't get a single attack of malignant hypertension, because once you get that, you only have 24 months, my brother, sister, and my friend, my YouTube follower, or whoever is watching this video. I do not want you to die. I do not want you to live an unhealthy life. And that's why I want to address it here, because it leads to heart attack, heart failure, stroke, kidney failure, and ultimately death. Please like, subscribe, and share to my channel, and share this video. Educate the people around you, because people keep looking for other ways to bring down their blood pressure, and then end up into this kind of crisis, which we called malignant hypertension. Prevent the people around you from getting into this kind of situation. And that's the goal, that's the sole purpose of this video. Thank you so much. Have a great day. Bye bye.